So tonight I'm going to talk about specifically sports-related concussions. There's a spectrum of severity. I'm going to talk about more ones that we would see in this high school setting, ones that would need some help from the teachers and the athletic department. So in particular, sports-related concussions is what I'm going to be commenting on tonight versus more severe motor vehicle accidents or something more significant like that. All right. If people have questions throughout, just let me know. If you can't hear me, missed what I said, let me know. It can get pretty heavy in the science background of it. I'm going to try to not get too heavy in it and just talk a little more real world, but I will talk a little science in the beginning. If something doesn't make sense, just raise your hand, let me know. I'd like people to walk away knowing stuff, not just blank stares at the end, being like, what's a concussion? I don't know. So the whole topic is facts and myths. So I kind of want to have a little conversation too as we go along. What do people think and not think about it? Because there's a lot of false and misinformation out there. Let's see if this works. So a little bit about me. I'm a physical therapist at Kinetic Physical Therapy in Chester Springs. I'm part of their adolescent sports medicine program where I treat post-concussion syndrome. I also I'm a lab assistant at Newman's physical therapy program. I got my doctor of physical therapy from Newman University as well. And I have my strength and conditioning specialist by the NSCA. This will work. All right, so objectives. So tonight, I want to help us learn what a concussion is, some signs and symptoms of a concussion, general guidelines of concussion recovery, the role of the physical therapist in a concussion, and how to get them back to play safely. So what is a concussion? Does anyone have any ideas? If someone asked you what is a concussion, what would you tell them?
Brain bruise.
Brain bruise, okay. Anything else? Anyone? No? All right, well hopefully we can answer that better in a few minutes. So this one's a little wordy, but this is what the CDC defines a concussion as. Concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head or the body that causes the head and brain to move rapidly back and forth within the skull. This sudden movement can cause the brain to bounce around or twist, causing some chemical changes. I underlined that, so that means we're coming back to it. And sometimes you can cause some stretching and damaging to the cells. So keep in mind those chemical changes. So I'm going to show a 60-second clip, which is also someone explaining what concussion is to get a better sense of it. Then we're going to come back to the PowerPoint.
A concussion is a change in how the brain functions. So it's not a structural injury, it's a functional injury. And so when the body or the head is struck, the brain will slosh around inside the head and it changes how the brain works.
Concussions in youth sports is important because you're talking about a potential threat to the development of that youngster's brain. Anything that potentially affects that in a negative way has to be fully reckoned with and dealt with.
It used to be felt that you needed to have loss of consciousness in order to be considered a concussion, but in sport-related concussion, loss of consciousness only occurs maybe 10% of the time.
Sometimes it might just be like an elbow to the head, or just a tap, or somebody coming down from a rebound and hitting you on the back or something like that, and you get a concussion.
You can get them also without any contact to the head. You can get concussion from a whiplash, a car accident, whatever it is. It happens.
The bottom line I want you to get from that video is concussion is more of a functional change. So going back to that functional or chemical disturbance in the brain, they did a study in looking at some of, this is the sciencey part, some of what's going on in the brain from a cell molecular level. If you look on the bottom of that graph, it shows number of days. Cerebral blood flow, we know, usually decreases post-concussion when we have a concussion, and that's part of post-concussion syndrome. If our brain got jostled around and isn't working well, we need energy to help that brain fix itself, right? Where does energy come from? It's glucose, it's sugar, and it comes from the bloodstream. If we have decreased blood flow to the brain, you don't have all that good stuff that helps the brain do what it needs to do. After a concussion, no imaging is going to show that you have one or not. You can't go to the emergency department, get an X-ray, an MRI, or a CT scan and show there's a concussion. It won't show up. The reason is it's not an anatomical injury. If you tear a muscle, you can get an image and it'll show it. If you get that brain bruise, it's not showing up as a concussion on imaging. Now, of course, we can always see if there's a bleed, if there's swelling, edema, or something of that sort. But as far as a sports-related concussion goes, there's not imaging to show that one way or another. The reason being, these chemical changes occurring. If you look above the x-axis there, see the potassium, the calcium, there's other ions that are out of place. They're mismatched. So to have signals go through our brain, we have electrical impulses. For those electrical impulses to go through our brain to tell our eyes to move around the right way, we need these ions to be in the right spots for these charged particles to send that signal. Well, they're all in the wrong spot. I like to say, think of, you have oil and vinegar for salad dressing, you mix it all up, it takes time for it to settle back out. After a concussion, it's all mixed up. What helps it settle back out? Well, more blood flow to the brain to provide it the fuel. If we don't have blood flow and fuel to the brain, we're not going to settle it back out. While it's trying to settle is when we have our worst symptoms. Does that kind of make sense a little bit? So that's basically why we can't see concussions on imaging. These chemical changes are not shown there. Now, if someone disagrees, because I'll tell you there's one little thing the FDA just approved, raise your hand and let me know, but we'll talk about that at the end otherwise. So, signs and symptoms of concussion. What are some common signs or symptoms that people tend to correlate with concussion? Any thoughts? Nausea. Light sensitivity. Headaches, absolutely. So I like this chart here because it kind of breaks it down into categories. So top left, cognitive, feeling mentally foggy, difficulty concentrating, difficulty remembering. Those are some ones that may affect more of our school tasks and getting through that. On the top right, the physical, the headache, nausea, visual problems, dizziness. We also have the bottom right, sleep. Sometimes we can be too drowsy during the day. Sometimes we fall asleep too easily. Sometimes we don't sleep enough. It can sometimes make you not sleep enough post-concussion. Also some emotional changes. We can have a lot of irritability, sadness, things of that sort. So the incident rate of concussions, this stat's a couple years old, but the CDC was reporting upwards of almost 4 million concussions a year happen annually. It's hard to get a good statistic on that because it's not reported very well, especially in rec leagues. You know, school leagues reported more commonly, but not so much in the recreational. Bottom line, it happens often. So why more concussions now than when parents played sports? When I have some of my patients come in, the parents say, well, you know, I played football, you know, for 12 years and I never had any issues. So how come my son's getting these all the time now? A couple reasons why. One, more youth are playing sports year-round. So if you're playing year-round, you have a higher exposure rate. That makes sense why that would be increased. We're starting organized sports at younger ages. There's kids in elementary school now starting Pee Wee sports. Again, higher incidence, or higher rate of exposure, so you're gonna have a higher chance of getting a concussion. The number of female athletes in contact sports has been shown to be growing over the last 20 years. We're getting better at identifying concussions and doing something about it, not just saying someone rang their bell and now they're going to just sit out for a few minutes and go back the next day. We're getting better at diagnosing them and identifying them and pulling these kids off the field. And this is a hot topic, helmets and equipment. Are we padding our kids so much now they're overconfident and they're just throwing their bodies out there doing unsafe tackling techniques and now they're getting hurt worse? So that's hugely debated. They look at concussion rates of football players versus rugby players. Rugby with no helmets, they tend to tackle more properly, hence this debate. Football players with the helmets and all the pads feel more invincible. They'll just throw their bodies out there and tend to be a little bit more vigorous with their techniques and maybe a little less safe when they're playing. This presentation, I don't want to scare us from sports. I don't want people to pull kids out or stop playing soccer or volleyball or basketball or football. I just want us to be aware of what concussion is and some of the facts and myths. So there's some good news with concussions, and that is most people recover within 10 to 14 days spontaneously. That's really good news. A large majority of sports-related concussions resolve on their own in those 10 to 14 days. Only when they last longer do they need a lot more medical intervention. I like the little comic down low. I never played baseball, football, or soccer. I grew up in the concussion era. We hear about all this bad stuff with concussions all over the news, but the last thing we want is for everyone to just go home and be couch potatoes, not to play sports. So it's definitely not the message I'm sending. I want people on the fields. I want people playing. We just need to be good at identifying when we should take them off the field and then when it's safe to return them to the field. So protracted recovery. When they don't recover in those 10 to 14 days, then we'll say they have a protracted recovery. I'll diagnose that as post-concussion syndrome. So we have some ways to figure out if that guy on the field who got hit, if he's going to have a protracted recovery, or if we think he'll get better in those 10 to 14 days. So they looked at some studies, looked at some films of sports teams and when people are getting hit, when they're having protracted recovery, or when they're getting better in that 10 to 14 day window. And they showed that some high school athletes with symptoms of drowsiness, nausea, and difficulty concentrating right afterwards, they tend to fit more that protracted recovery group. So these are a little kind of a cheat sheet for you. Is this person going to be worse a lot longer, or will they get better in that 10 to 14 days? Some non-athletes, they showed that after they got hit, if they had light sensitivity or sensitivity to sound, they tended to fall in the protracted recovery group as well. We know that if you have more numerous symptoms in the first 48 hours, more likely you're going to have a protracted recovery. And interesting, they're looking at some risk factors: anxiety, depression, ADHD, history of migraines, and a history of neck pain prior to the incidents also protracts recovery. There's debates on how and why that impacts it, but that's been shown to be correlated there. Some on-field predictors. So if some people here, they may be on the field when it happens, they may be trainers or coaches. I think this is interesting. They did a study and looked at if the person has on-field amnesia, specifically if they forget what happened right before they got hit. It's the person that got hit, they got back up and they said, "What happened? I don't know what happened." That's a sign of a higher chance of a protracted recovery. If they are dizzy right on the field, or poor coordination, if they're getting up and stumbling around a little bit, they're going to be a higher risk of having that protracted recovery versus just that initial 10 to 14 days. Also, significant headache. So if someone gets hit, they have a concussion, what do we do next? Who are the people that help with them? It's definitely not just a physical therapist. It's a whole team approach. There's a multidisciplinary approach to get that person back to the field playing safely. That can be anyone from the emergency department. Oftentimes if they're a bad hit, they may go there first or in urgent care. Then they may get referred to their family physician who checks them out, and they may send them to a neurologist or a concussion specialist, which is an MD that specializes in concussion treatments. Then they may refer to a physical therapist such as myself. The athletic trainer, the school nurse, and the school guidance counselor all help get them back to play on the field and get back to the classroom 100%. And I also put friends and family. So when I have my patients that have those protracted recoveries and they're lasting 2 or 3 months, that's really rough for them. It's an injury that's invisible. No one sees it on them. You don't have a boot. They're not in crutches. They don't often get the respect that it deserves as a brain injury. That is very significant. Too often do I have my patients come in and say, you know, I'm at school and I'm getting pressured from the coach to get back, or my friends to go to the movies and I can't because that bothers me, or my teacher to do my homework. So friends and family is huge as a coping mechanism to help give support to that person while they're going through that time. They can sit there and smile, but they can still feel pretty bad on the inside. So as a physical therapist, what do I do? What do I help with? There's a couple things here, and I'm going to go into them more in depth in a second. But I can help look at their activity tolerance. Can they run around or not post-concussion? Some balance training, some eye training. I'll treat any whiplash injuries they may have. Depending on how they got hit, they may have snapped their head back and forth. They can have some cervical issues. So as a physical therapist, we definitely address cervical issues. We'll help them return back to their sports activities or weight training or whatever physical activity they were doing. We'll help them with that. Sometimes they have motion sensitivity issues we'll help with, and we'll use virtual reality to help with a few of those activities. So the Berlin Guidelines. The Berlin Guidelines used to be the Zurich Guidelines. Every 4 years, professionals from around the world meet, Zurich, now Berlin most recently, and they'll discuss about what and how we should treat how we should treat concussions as professionals, and from all settings, from the PT, from the family physician, from the athletic trainer. So they kind of set the baseline for the world to then make their concussion protocols based off of it. So then the USA looks at it afterwards, and the NCAA may take their protocol from it, and the NFL may take their protocol from it. But the Berlin Guidelines is a central hub where everyone takes their information from that. They're the kind of gold standard for things. You can Google Berlin Guidelines. It's a dozen pages of a document. It gets pretty wordy, but that's what most people will base their guidelines off of that. So that's kind of like our gold standard for what we should do and when. So the Berlin Guidelines says that currently there's insufficient evidence that prescribing complete rest achieves the objectives of getting someone back to sports. After a brief period of rest, so about 1 to 2 days of resting, not doing much activity at all, then the patient should be encouraged to become gradually and progressively more active while staying below the level of causing an increase of symptoms. It is reasonable for an athlete to avoid vigorous exertion while they are recovering. The exact amount and duration of rest is not yet well defined. So basically what this is getting at is how long do we rest after we get hit? We know we get hit, we have these symptoms, we know that we need to stop playing for a bit, but for how long? And then when do we start moving around to get better? When do we start some eye exercises, some vestibular exercises? When do we do that? Not within the first day or two, but we don't wait till we're all the way better. We don't wait till all the symptoms are gone and then start to do a little return to play. We have to start earlier. That's where I come in. So when should you start PT? They've been doing more and more studies to figure out exactly when. We know it's not the first 2 days, but is it a week? Is it several weeks? Well, here's 2 studies like the reference. The one study showed there's better outcomes if rehab was started at 2 to 4 weeks compared to 6 weeks out. Athletes who did not return to play or exercise until completely symptom-free, on average, took longer to return to sports. So we are starting to get them moving and doing certain activities while they still have some symptoms. But how much of that activity is what we're tracking and making sure it doesn't go that high. We have certain standards and tools that we'll use. So we know that a dark room for more than several days will delay recovery. I don't like it when I hear someone come from a family physician, they said, just stay in a dark room, don't do anything for a week or 2 and it'll get better. Now we know that 10 to 14 days, most people get better on their own, but we don't want to tell someone to do absolutely nothing for 10 to 14 days. It is good to move around a little bit after that first day or 2. So keep that in mind. That is a huge takeaway from today. You don't just sit in a dark room till everything's good. First day or 2, don't do anything. After that, we got to start getting back into our activities some. How much or how little is debated. Sometimes we can get away without seeing a physical therapist or other physicians with it. Sometimes we do need that medical intervention. So exertional testing. So I said we should move around a little bit after concussion, but how much do we move around? Do we get our heart rate up to 40% of our max heart rate? Do we get it up to 80% of our max heart rate? Well, we use the Buffalo Concussion Treadmill test or the Bulky Concussion Treadmill test. This tells me exactly which heart rate you should work out at throughout your concussion recovery. They've been doing a lot of studies with this. The CHOP concussion seminars each year, they're talking about this a whole lot. It's basically a 15-minute treadmill test. Kind of looks like a stress test a little bit, but we track your heart rate, your blood pressure, and your reported symptoms, headache, nausea, blurry vision. We track that, and at a certain point, we'll cut you off depending on how much the symptoms increase. We're not going to allow it to increase much, but once we know it hits our standard of increasing too much, we stop the test. Now that heart rate, maybe it's only 5 minutes into it, let's say your heart rate's 130 beats a minute, that's your new max heart rate. Normally we know our max heart rate could be 220 minus our age. So for a high school athlete, that's pretty high. But now post-concussion, maybe their new symptom threshold max heart rate is only 130 beats a minute. Now we're gonna work them out at 60 to 80% of that. So we have ways to track how much or how little do we do after that 1 to 2 days rest. We have an awesome test for that. This basically just explains the test a little bit. It's a 15-minute test, looks like a stress test. Aerobic exercise is so important post-concussion. We know that it's going to improve factors that help improve nerve growth. So you see the improved cerebral blood flow, the CBF. We know we have decreased cerebral blood flow to the brain after concussion, right? But we need better blood flow to bring the glucose, the sugar, and all the fuel to the brain so it can do a better job of sorting out all of the ions being in a bad spot. So we need to do aerobic exercise to improve that blood flow. As a PT, I also do a lot of vision and vestibular therapy. There is a ton of good evidence to support that post-concussion, our main focus should be on vision and vestibular therapy, and if they have any cervical issues. Post-concussion, if someone has blurry vision or they can't track an object well, their eyeballs are usually okay. What it is the signal from the eyes back to the brain, and interpreting that signal is off. So the eyes tend to work okay. There's muscles in the eyes. They can work okay, but the signal to those muscles to move it around is not what's working okay. So let's say someone has a difficulty tracking a baseball. They try to watch it, it goes too fast, it's blurry, they can't see it now. What we need to do is to retrain those eyes to take those good signals and to slowly learn how to track again. You may see people or videos where they're holding a pen and they're moving it back and forth to track their eyes, right? What we're trying to do is improve that strong signal in the brain saying, hey, I need to focus my eyeballs on this pen and it needs to stay there as I come across back and forth. We're re-encouraging that track or that signal in the brain to rewire how to use those eyes better. So what's kind of interesting is eyes are okay, some of the signals to the brain are okay, but its interpretation is what's off. Top left corner is someone just doing what we call the Brock string. That's just a couple beads in a string, and they're working on focusing at certain depths. You can see down bottom right, someone's doing some vestibular balance training. They're on an unstable surface doing some ball throws, or trying to do multitasking during the balance training. So virtual reality, there's more and more colleges are starting to do some research with virtual reality as far as diagnosing concussions and treating concussions. So going off of what I said, the processing is what's wrong, not so much the initial vision. So if I'm seeing the thing properly, but I'm not processing it well, that's where my issue lies. Well, with virtual reality, sometimes they'll do things like they're watching a roller coaster, and on the roller coaster, it looks like they're going side to side. Well, you and I both know that they're standing still, but yet that patient falling over. Why is that? Their eyes are okay, but that processing information is off. Their brain is literally telling them you are going to the side, so you're falling over right now. So what we'll do is talk to them while they're doing that virtual reality. Hey, you're leaning to the right, you need to recorrect yourself. So that person's processing the information, saying, you know what? I know my eyes are telling me false information. I gotta be good and correct that information. I like the bottom left picture. That lady there is getting so much input at her, and she needs to process what she needs to do next. So kind of like that visual for this idea, where your processing is off. You're getting that phone call, you're getting that text, and whatever else she's getting. All the information is coming to her, but her process for it is what's impaired. We also treat any whiplash injuries. You may think of that from a car crash, hitting your head back and forth, but it can absolutely happen in sports-related concussions as well. There's some debate on helmets increasing the chances of some whiplash injuries on the growing child. So someone's hitting their growth spurt, they're getting taller, but they're not filling out yet. They may not have enough neck strength, so they're kind of like a bobblehead doll sometimes, where a little hit, they can get a lot of whiplash going on with a lower impact force. Once they're getting further along in the recovery, we're going to do sport-specific drills in PT to help them get back to exactly what they need to do for their sport. A treatment session for someone in football is going to look different than a swimmer or track athlete. So now that we're treating someone, they're getting a little bit better, we want to get them back to the sport. So what do we need to do to get them back to sports? So the Berlin guidelines, our overarching body, is going to give us all of our information. They have a 6-step return to play guideline. Now, in America here, we have a 5-step return to play. The difference is their first step is really just getting back to daily life, getting back to showering, changing, doing whatever. Their spectrum of concussions is a little bit broader than just the higher level sports-related concussions. So you'll see down here, I wrote graded introduction to physical exercise is a 5-step process. If you go to a concussion specialist or some neurologist and they say you have a return to play protocol, they all mean a 5-step return to play protocol. Berlin guidelines, if you Google it, will have 6, but we can skip over the first step because they're probably doing their activities of daily living on their own already. So return to play. We know that after their injury, we rest 1 to 2 days before we do anything. After that, we do this 5-step return to play protocol. An athlete must be symptom-free before moving on to the next phase of the return to play protocol. Each stage lasts 24 hours, so a minimum of 7 days to get them back to their sport. 7 days is when that metabolic cascade starts to diminish. That metabolic cascade is that graph that I showed you in the beginning where those ions are all over the place and that blood flow is too low. Because on average, 7 to 10 days, that blood flow comes back and now that brain is good again. We don't want to return someone to sports too early when that blood flow isn't there. We're going to have a much worse issue after that. So the 5-step return to play protocol looks something like this. Stage 1, light aerobic exercise. That's me doing that treadmill test with them, figuring out which heart rate to work out at. Then they're probably doing walks at that heart rate on their own for a little bit. No weight training in this phase. Once they're good with that, they're going to increase their heart rate a little bit more to a more moderate pace. They may start to intro some light weight training activities. Stage 3 is more heavy, non-contact physical activities. They're sprinting, they're running, they're jumping, more sports-related tasks. Stage 4 is that athlete is back to practice, back to full practice, everything. Stage 5 is back to play. They'll differentiate practice and play because usually in practice, you don't have anyone, let's say football, you don't have anyone really trying to hit you hard and any bad hits. You'd hope it's a little bit more regulated. In a game, kind of anything goes, they got to be really prepared. So they'll differentiate, return to practice first, full practice, including hits and everything else in football, and then back to play. So what if I return too early? What happens if we return that athlete back too soon? Well, over 90% of repeat concussions can occur within 10 days of the initial injury. If you're returning back too soon, your reaction time isn't there. Your ability to guard yourself and to avoid that hit or avoid the ball is not going to be there. So that can put you at risk for numerous other injuries, not just concussion, but an ACL tear. Forced exercise in rats within 1 week of an injury showed reduced BDNF, and what that is something that helps the brain heal itself. So it's hard to do a lot of concussion studies on humans because we can't standardize concussions. Can't line up 10 people, pop them all in the head and see how they do. It's frowned upon. In rats, they do that. So there's a lot of concussion research you'll see coming out of animals for that reason. So if we exercise rats too much, too vigorously in the first week before they're better, it's going to just delay their recovery. That goes all along with 1 to 2 days of rest, and then figure out how much or how little activity we need. We have to do some, but too much can be bad as well. Is anyone familiar with impact testing? Right? I feel like everyone's kind of heard of that now. So for those of you who may not know, it's a computerized test, tests numerous things, memory, reaction time, things of that sort. Well, they did an interesting study. They had people that had concussions take impact testing, and they were cleared to return to sports. But then they took that same group of people, they worked them out for a little bit. They had them sweating, they had the heart rate up. Then they took the impact testing again, and they flunked it, showing that we can't just make return to play decisions based off of impact testing alone, because impact testing doesn't test anything like sports. It doesn't test the demands that they need for return to play. So some people get caught up too much in impact testing, what the scores are. I love impact testing. It needs to be a piece of the puzzle. It can't be the sole reason why we return someone to play. Also with impact testing, sometimes they're administered in a busy, loud room, so their baseline scores are pretty low. For impact testing to work the best, you need to have a baseline score. In the adolescent years, you need to redo that score every 1 to 2 years. As adults, we can delay that a little bit longer. But if you want a good baseline score because they were in a loud, noisy room at the end of a school day, and the last thing they cared about was taking an impact test, you can imagine they're not going to do very well on it. So when they get hit and they go to take it again, well, we're trying to get them back to that level that wasn't even that focused. So keep that in mind when we're making return to play decisions. Sometimes I'll use this dizzy bat as an example of returning to play too early. So you can imagine if I had someone here, I won't do it today, and I had tennis balls and I go to throw it at them, they can catch it, they can block it and guard themselves. If I had them do a dizzy bat and they're a little bit off balance, and then I put them in sports or I throw the tennis balls at them again, they probably aren't going to be able to have that quick reaction time they need to guard themselves. Half a second can go a long way between taking a bad hit in football or just guarding yourself just enough to take a better hit and absorb the blow better. So keep that in mind. If you're not 100%, your reaction time's still off a little bit, you're at a higher risk of getting injured with an orthopedic injury, ACL tear or something else, as well as worsening that concussion. If there's one thing to take home from today, it is this: Heads Up Concussion Training. Heads Up is a program done by the CDC.gov. I have some handouts that I'm going to pass around for people by the CDC.gov. It's called Heads Up Concussion Training. So it's free, go online, check this out. It is awesome. There is like a 30-minute presentation quiz that you can take. And let's say you're a recreational coach and parents say, hey, what do you know about concussions? nothing. Or you can say, hey, I took a little course. I have a certificate. I learned some of the signs and symptoms. You know, I have a baseline knowledge at least. We have these standardized tests that you can kind of take. They're easy. You can retake them. But they're awesome to kind of standardize what should coaches know, what should parents know, what should school administrators know. Well, that's exactly what I printed out, so I'm going to pass this around. This is just what you'll find, some of the info on the website there. But one is concussion fact sheets for parents, for high school athletes, for the school professionals, and for coaches. So you just take a quick peek, and we'll just pass it around there. All free, awesome material. They want you to go on the website and pull this info out, especially for recreational leagues. High school leagues tend to have a trainer there, tend to have better supervision and care. These recreational leagues, they don't have the money and resources for this, so it's more important for those coaches and parents to have a better idea of when to pull a kid out and when they can go back. So if you go on this heads-up concussion training, what will you learn? That kind of 30-minute course will help you understand what a concussion is, potential consequences of the injury. Hopefully you know a little bit after talking today. It'll help you recognize some of the signs and symptoms and then how to respond afterwards. It'll help you learn about steps to returning to activity, kind of what we talked about today so far. And it'll help you focus on prevention and preparedness to help keep the athletes safe and so they can keep playing season to season. So I'm going to quickly go to the website just to show this to you because I want everyone to really take this home because this is an awesome resource to have. So this is the website right here. So if you can look on the left-hand side, these are some of the titles that you can go through. Helmet safety, heads up to parents, youth, sports, or school sports, excuse me. So there's a lot of information here. There's a lot of videos. It is just an awesome resource to check out. So the title of this presentation is Fact or Myth about concussion. So now's the test. Now's the time to see if we were listening or not. I know school's out, but... So first question, fact or myth? Do you have to hit your head to sustain a concussion? No. We should all hopefully 100% get this one correct. The answer is no. Is a myth. You can get a concussion from just a body hit or a whiplash injury. Reason being, like we talked about before, your brain inside your skull gets rattled around a little bit. It's sloshing side to side when we take that hit. If you hit me in the chest, I can still have that head go back and forth, rattling it around. I can get a concussion. I have the bull rider here because, again, I don't want to scare people with this. I want to give some good news with this too. Bull riders, they're going back and forth a lot, right? You would think that every single person would come off of that with a concussion. That's not the case, actually. Unless they're thrown from the bull, they tend to do pretty well as far as concussions go for how vigorous it is. One of the reasons that we think it is they're expecting it, right? They're going with the motion. They know when it's going forward and backwards, and they're moving with it. It's like seeing someone, I'll use that football as a classic example. If someone's getting hit from behind, doesn't see it coming, they'll probably have a bigger whiplash style injury. If that head's moving quicker, faster, you can imagine that would be a worse hit because it's unexpected and uncontrolled. These guys are moving a lot, but they're going with it. They're more controlled. Another reason we don't want to send someone back too soon after a hit to sports, because if they're not controlled, if they're not going with it and seeing that hit coming towards them in time, that's going to increase their risk of injury. Fact or myth? Do you have to lose consciousness to have a concussion? No. This one's a little bit outdated, but still people come to me and say, well, he didn't lose consciousness, so he's good, right? No, not at all. Some people will say about 10% of the time you lose consciousness. Bottom line, if you lose consciousness, you know you're coming out and you're going to go see a medical professional. But on the other hand, you don't have to have that happen for you to suspect a concussion and get removed from play. Fact or myth? Most sports-related concussions resolve within 10 to 14 days. Good news, most do, right? Talked about that. There is good news here. It is recoverable. It usually heals 10 to 14 days without anything. That's good news. Fact or myth? Which type of imaging is best to diagnose a sports-related concussion? X-ray, CAT scan, MRI, or none of the above? Any above. Now, let's say someone got a really bad hit in their sport and they went to the emergency room. I'm not against getting imaging. They want to rule out something more serious, a skull fracture, a bleed, something of that sort. But I want people to know you don't go to urgent care, get an x-ray, then they say, oh, your x-ray's clean, you don't have a concussion. You say, that's great, an x-ray's clean, but what concussion test did you do for me? Because that means nothing. That means absolutely nothing. Some of our concussion symptoms don't occur right away. They can take a day or more, several days longer for it to really show up on that person or that individual. So we talk about doing sideline testing to see, hey, on the side of that bad hit, is that person good to go or not? Well, there's a limitation there, and that is we don't always see the symptoms right away. So there's a debate on how quickly someone should or shouldn't go back to sport there. Bottom line, if we suspect it, we should definitely remove them from play, get them checked out. So since the sports-related concussion is a functional injury with chemical changes, it won't show up on imaging. Now, that being said, the FDA just came out recently with a blood test to diagnose concussions. They tested like 1,900 people, and it was very accurate, very, very accurate. The thing is, you can't go to the hospital right now and get that blood test, so it doesn't really help you and I right now. But imaging's not helping us diagnose this so much, but there are new things out there that are coming. Give it another 5 years, I bet you will see something like that more common throughout. But a little blood test to help diagnose concussion or not. What are they looking for? Yes?
Can't go to the hospital and get the blood test now?
Not right now. Not right now, yeah.
Not available still?
Correct, not available. Showed it's safe, showed it's effective, showed it's specific and sensitive, very good rates on that, but just not currently broad and out there for everyone.
Looking for proteins? Or?
Yeah, exactly. So, we have some chemical changes, but on a very small cellular structure, we can have some, anyone hear of tau proteins, the big CTE debate, tau proteins? They're looking for stuff like that in the blood. After, I believe it was after an hour after the hit is when they would do the blood test, not before that. Then they would look in the blood and see, is that there or not? There's some other ways that they'll determine it in a research setting, but again, not available in any hospital anywhere. Well, this thing that FDA approved just happened. It just happened 2-3 months ago. It was very recent. So that's going to take time to go out. They did a study of 1,900 people. That's pretty solid, 1,900 people. But I would suspect that they want a different body or a different institution to also research this to be a little more independent before they go out. The FDA approved it, which is awesome. So I really would expect this to get approved through insurance, and insurances pay for this to happen because blood tests are pretty cheap compared to MRIs cost $2,000 each on average. So you would really expect that to happen sooner than later. In research studies, they'll use some fMRIs, some functional MRIs, but those are usually, they're not getting those at the hospital, it's just not available. Those can show some concussion effects. For sports-related concussions, those don't always show up because these are our more mild concussions versus our severe car accidents or things of that sort. Or soldiers coming back from war with traumatic brain injuries from blasts and things of that sort. Yeah, but I would really think the next couple of years that the blood test talked about, that'll be more available.
A bunch of soldiers that came back and a bunch of Olympic athletes that were in the Olympics in the past couple of years that do have concussions and are still suffering from actually terminating their brains to two sides and are being more worked on.
The Boston Brain Bank is now getting more and more.
And some of the famous boxers are actually compounding brains.
Yeah. And one thing they're researching is obviously those tau proteins to look at CTE and how can we help prevent this happening to more and more people. And there's also a big debate on what's worse. Is it the boxers with a bunch of smaller hits, or is it the NFL players that get fewer but larger hits? I think it's safe to say both aren't good. I'm not sure how much it matters for the population for most of the country. There's high-level athletes, a little bit different story. There's a lot fewer of them. But the brain bank is getting many more donations, and they got like the first several female brains we're looking at now too. So this is a huge area of research that's only going to expand in the next decade. Fact or myth? A healthcare provider should prescribe strict rest until all symptoms resolve before beginning any aerobic exercise. What do we think? So, false. We don't want to do nothing until all the symptoms are gone, right? We can have some symptoms and do a little bit of aerobic exercise. How much or how little? Well, we can do stuff like that treadmill test we talked about for someone who's a little bit more impaired. Some people have concussion that's pretty minor and they can start to do a little walking on their own and say, hey, I walk at these slower paces, I feel okay. But we know that doing nothing is not the way to go. Do helmets and mouth guards help prevent sports-related concussions? What do we think? No one's shouting out too much with this one. So as far as a systematic review goes, that evidence says no, it does not. Now you will definitely have some literature out there that says it does. So do helmets help with skull fractures and other injuries? Absolutely. Do mouth guards? Absolutely. But as far as a high level of evidence goes, there's none right now to show that helmets or mouth guards help with that. You'll definitely see advertisements for it. You'll definitely see, you got to look into the research. If you want to get really fancy on research, I talked about there's levels of it. Systematic review's the largest. Right now, there's no systematic review showing that there is evidence to prevent concussions with that. Now, it doesn't mean you shouldn't wear them, right? You would think that mouth guards and concussions can help, so why not do that, right? So I'm not saying doesn't make a difference, don't care about it. No, I do care. I think people should wear them, especially mouth guards I think are awesome. But that being said, right now, we're talking about at the CHOP Concussions conference, it's not there right now. It is really hard to do studies on this, right? Because how do you test that this helmet helped this kid with concussion, not this kid? Did you hit them both in the head at the same time and then track their symptoms? You didn't, because that's illegal. So, it's hard to say there is good evidence for this because it's so hard to do that research. So keep that in mind. Sometimes we have limitations on how we can do these studies, right? How do you really test that out well? That's a little bit tricky. It's a little bit tricky.
Yeah, one of the biggest things out on the market nowadays, they have a mouth guard out, even by Dick's, and it's got a big hole in the center. You put your teeth in it, and supposedly it helps reduce a lot of concussion because it allows more oxygen to the brain. It's a fallacy, it doesn't work.
Yeah. I have parents say, yeah, I bought the most expensive helmet I could find. Well, that's good, but yeah. Absolutely, absolutely. So the football versus rugby, kind of mentioned that earlier. Rugby has a lower concussion rate, but why is that if they don't wear helmets and football players do wear helmets, right? Especially with the growing ages, again, like you talked about, you hit those growth spurts, you're taller and lanky, but you don't have the neck strength there. There is some really good evidence, though, that better neck strength can help reduce the risk of concussions, because you don't have that whiplash effect as much. So there's definitely some good research out there to look at neck strength to help prevent it over just helmets. Now, most sports, you either are or aren't wearing helmets, so you don't need to worry about it too much, right? Football, you're wearing them. If you don't wear it, you're not going on the field. But it's interesting to kind of look at how much or how little that really does help. If your headache goes away, that means you are fully recovered from your concussion and you've returned to play. What do we think? No. So just because you can sit there and say, hey, at rest, when I'm sitting, I have no symptoms. I'm good to go play sports. Well, we did an impact test study where they passed it, but then they ran around and they took it again and they flunked it, right? So we know that just because at rest you have no symptoms doesn't mean you're good to go. So again, be mindful when someone, let's say our sideline testing, if they're just sitting there on the field, hey, I have no symptoms, coach. All right, but you're just sitting here, not doing much. We need to get them moving around a little bit more and feel very confident they can go back to play. Last one, fact or myth. Everyone should get this right, because I already have it up there. You should check out the cdc.gov website for heads-up concussion information after this presentation. Fact or myth?
It's a good play.
Fact. Thank you. Thank you. Everyone got 100% on that. Brains are awesome. I wish everyone had one. Think about this for a little bit. When you have a concussion, you have to think for yourself a little bit too. It is a team approach. If kids are getting concussions, talk with your parents. Make sure it's more of a group decision to get back to sports, not just you saying, I really want to get back to it. I want to convince my coach I'm good to go. Be mindful. You got one brain. You sprain your ankle, young and healthy kids will get better. Concussion, don't mess around with this. This is no joke. It's no joke. Concussions are a mild traumatic brain injury, right? They are a traumatic brain injury. Good news, we can get better with them, but we got to give them the seriousness that they deserve. So in summary, if you suspect a concussion, sit out of play and seek medical attention. The reason we're seeking medical attention is we may not know what we need to look for or not look for. There are some people with some good training that we can talk to on the sidelines, especially with school sports, and make that determination for us. Do not return to play too early, or you may have a significant risk of injury. Again, it may not even be another bad hit to the head, but it could be blowing your knee out or something else. Use the return to play protocol, that 5-step return to play protocol. Any school, their athletic trainers are using it, or they really should be, because it's kind of required. The recreational leagues is where there's a lot more leeway. You're in a rec league and someone gets hurt, when they go back, that's where it gets a little bit more iffy. Concussions are treated with a multidisciplinary approach. It's not just a physical therapist, it's not just the athletic trainer or the family physician. It's usually a group that gets that person back. So everyone needs to be talking, communicating on the same page. The teachers need to be able to help. The family and friends got to be there for support. Active rehab, and not just sitting in the dark until all your symptoms resolve, is shown to have better results. We know that the days of just sitting in a dark room till you're better are done. We sit and relax in a dark, quiet room for 1 to 2 days, then we got to get back to something. Thank you very much for spending your evening here.